So good evening, everyone, and welcome to the Women's Health Awareness Virtual Series, Real Talk with the Experts. This is the first webinar for our 2024-2025 Women's Health Awareness season. I'm Dr. Packenham, Chair of the Women's Health Awareness Steering Committee. So on behalf of the National Institute of Environmental Health Sciences, the Women's Health Awareness Steering Committee, and our co-sponsors, the Durham Alumni Chapter of Delta Sigma Theta Sorority Incorporated and North Carolina Central University, we are happy to have each of you join us this evening and excited to bring you this very important program. We are just full of joy tonight, and you're up for a special treat, as tonight our session is on chiropractic care. Unleash your inner healing, the power of holistic health and chiropractic care. To give you a quick overview, our session objectives are to compare different approaches to health, explore a different mindset of health by breaking down the chiropractic approach toward wellness, and to teach the philosophy, art, and science behind chiropractic care. Our speaker tonight is Dr. Simonsen. And after he speaks, we will have Q&A and have some chiropractic care resources, our November evaluation, and our Save the Date for Why 2025. So what will you learn from this webinar? You will learn how your body regulates and adapts to stress. It will introduce an effective alternative to healing naturally and break down any common misconceptions about chiropractic care. The national survey data shows that 11% of all American adults use chiropractic care in 2022. Of the adults who use chiropractic care, 85.7% used it for pain management. Data from 2017 showed that 3.7% of children aged 4 to 17 used chiropractic care during that year. So it's important to know that adults use chiropractic care as well as children. So just a few housekeeping details and webinar reminders. Our session is being recorded and it will be uploaded to YouTube. Closed captioning services are available throughout this webinar. Evaluations will be sent immediately after this webinar through email. And please make sure you all are muted as we are going through the webinar. For completing the webinar and evaluation, you will receive educational contact credit hours for your participation. We all have been using Zoom now for since 2020. So I know you know all the rules for Zoom, but your Q&A button is located at the bottom of your Zoom window when it is full size. So I'm going to skip that and go to the meat. I'm very happy to introduce to you Dr. Nikolai Simonsen. He is the proud husband, father, Christian, and Navy veteran. He attended the U.S. States Naval Academy and then transferred to North Carolina State University. He graduated from Sherman College of Chiropractic in Spartanburg, South Carolina. His specialty is in neurology-based chiropractic care, and this specialty focuses on the connection and function of the body through the central nervous system. He is a member of the International Chiropractic Pediatric Association with certified training in the care of newborns and pregnancy. He set out to be a chiropractor, not just to help with pain, but also to serve people in a way that would improve an individual's overall quality of life. He is very passionate about the work that he does and serving individuals in our community and trying to help individuals and families with their specific care. And of course, he's a gentle, very gentle chiropractor. So Dr. Simonsen, Please take it away for your presentation.
All right, guys. Well, first and foremost, thank you so much to Dr. Packenham and Jaslyn and the whole team at the Women's Health Awareness group over there. I'm so honored to be on this call with you guys. I love what you guys do. I think it's super, super important, and I'm just honored to be here. So thank you for that. But let me go ahead and share my screen here, and we'll go ahead and dive in. All right. So here's the title here, Unleash Your Inner Healing Potential, the Power of Holistic Health. My name's Dr. Nikolai. Dr. Packenham kind of gave me a introduction there, so thank you for that. So to start off with understanding chiropractic care and how it helps with health, we first have to understand what is health, right? So health has several definitions. The World Health Organization defines health as a state of complete physical, let me move this over, physical, mental, and social well being, and not merely the absence of disease or infirmity. The Oxford English Dictionary defines health as a state of being free from illness or injury. And here, since we're on the call with the National Institute of Health, the National Institute of Health defines health as a relative state in which one is able to function well physically, mentally, socially, and spiritually to express the full range of one's unique potentials within the environment in which one lives. Okay, so these are three major definitions of health, and they all talk about health as being a state, right? So if we look at the next slide here, what's the problem with these definitions is that each defines health as a state that you're in, as if health is something that you can achieve or as if health is something that you can reach. Now, we all understand that health is actually a journey, right? Health is not just black and white. You're not healthy or not healthy. Healthy is not achievable, it is pursuable. Health is a journey, not a destination. And health really is just dependent on choices, right? It's choices stacked on choices stacked on choices that's going to either get you healthier or not healthier, right? As our body ages and as we live our lives, we are never stagnant when it comes to our health. We are always either getting healthier or always getting unhealthier, right? And that's just based on your choices, okay? So, chiropractic's definition of health is a journey of adapting through life, best expressed by 100% function of the body within the limits of matter. So I have a couple things highlighted there. Adapting. Adapting is responding to your ever-changing environment, right? Our lives change day in and day out. And it's how our body responds and adapts to these stresses that's going to really define how our body thrives through our health. 100% function. What in the world does that mean? 100% function means if the body is working the way it was designed to, then we have good function. If we have good function, then we have good health. Limits of matter, there's several limits of matter. I've given a couple examples here, the big ones being age, disease, lifestyle, genetics, and choices, right? So, someone in their 20s is going to have a different definition or standard of health compared to someone in their 80s, right? But that doesn't mean someone in their 80s can't be considered healthy, okay? There are two different mindsets when it comes to health. One is called the allopathic mindset, and another is called the holistic mindset. Now, the allopathic mindset focuses on the body as individual parts and separate systems. It focuses on individual symptoms and disease. And this is what we would consider more your mainstream medicine, right? Individual systems would be your cardiologist, your geologist, GI gastroenterologist, um, oncologist, the study of cancer, right? So we have these separate specialists for the separate systems, and we have these specialists that focus on certain diseases. The holistic mindset looks at the body as one interconnected functioning system, right? where the symptoms and diseases of that certain system or of that body are only considered dysfunctions within that system. And this would be the holistic mindset would be considered more your alternative healthcare. Um, so allopathic medicine or mindset is more what we would deem a pathogenic model of healthcare. Now, pathogenic model is the study of what makes people sick through identifying and treating the illness to restore health. A pathogenic model uses external healing devices and interventions. It's the focus on factors that make you sick, and examples of pathogenic care are medications, vaccines, antibiotics, steroid shots. These are all things that, from an external standpoint, that we put into the body to address a certain sickness or illness, right? And the goal of pathogenic, allopathic healthcare is to reduce the symptom to improve the body, right? Now, salutogenesis is the opposite of pathogenic healthcare, and salutogenic is your holistic mindset, right? And this is the model of health that focuses on promoting health and well-being through a person-centered approach. Salutogenic care is based on the idea that people can maintain or improve their health and well-being even when faced with challenges. Focuses on factors that make you healthy. Examples of a salutogenic or a holistic mindset of healthcare would be exercise, eating healthy, therapy, self-care, chiropractic care, and many, many others, right? And the goal of salutogenesis or the holistic mindset would be to improve the body to reduce the symptoms. Now, I'll go back to this previous slide. So if we improve the body to reduce the symptoms, that's the mindset of the body working as an interconnected system. If we focus and to reduce the symptom to improve the body, that's more of an allopathic mindset where we're trying to focus on the body as individual parts and what makes it sick, right? So which of these two models do you think would be more focused on health and not sickness? It would be the salutogenic model, the holistic mindset, right? So what I call the silent assassin to good health is boils down to one thing. It's stressors and how your body adapts to these stressors. So, you know, our bodies are introduced to stressors every single day. And these stressors are getting more and more and more and more accessible to us um, with technology, right? So right now, your phone could ding, you could get a text message, you could get a phone call, and this text or phone call could absolutely change your entire life in the blink of an eye, right? We have stressors all over, right? And there's three main stressors in life. In chiropractic philosophy, we call them the three T's. We have thoughts, toxins, and traumas. And in simple terms, that's physical, mental, and chemical stressors. Now, we can't eliminate these stressors. We can't wrap ourselves in bubble wrap and hide from the stressors of life, but we can improve how our body responds to these stressors. So to break down the three categories of stress, physical stress is the one that you most commonly think of. It's your traumas, right? You have major trauma. Major trauma is going to be your quick one-time trauma. This and it doesn't have to be a severe injury. This is typically your accidents, car accidents, sport falls, slip, trip, falls. Birth is a big trauma, not just to mom, but also to baby as the baby's passing and rotating through the birth canal, getting pulled by the head, twisted and rotated to get out of the birth canal. Oftentimes is a major trauma on a baby. Childhood, the average 2-year-old falls over 35 times a day, all right? For anybody who has small kids and toddlers, you know what I'm talking about. Side note, I have 3 kids, a 5-year-old, a 3-year-old, and a 1-year-old, and they fall all the time. Okay, it's a normal part of childhood as they're roughhousing and they're playing, they're learning to walk, they're learning to, gain their balance and stuff like that. But these falls, these repetitive falls as at a young age, are traumas, right? Especially if this causes some type of issue in the pelvis or the low back or the mid back, not something that's going to give a 1-year-old back pain or a 3-year-old sciatica, right? But as they grow and hit these major milestones, hitting these, growth, this can cause issues, right? If they knock something out of alignment as a kid, as they progress into their later childhood, into their adult bodies through puberty, all this stuff, the growth spurts, whatnot, it can lead to symptoms later. So those are going to be your major, considered your major traumas. Minor traumas are the things that we often overlook. Minor traumas are going to be small, repetitive traumas, often mild with long-term exposure. There's going to be stuff like your posture at work, your hobbies, your sleep patterns, things like that, right? Most of us in this day and age work a desk job, which means we're sitting kind of hunched over a desk, working at a screen and stuff like that. And I'll tell you, you already know it, but our bodies were not designed for that, okay? And if you do this for, let's say, 4 hours a day for 20 years, that's going to cause a lot of issues, okay? Mental stress. Mental stress is oftentimes our most overlooked stressor, okay? Luckily for us, it's getting more mainstream focus now with mental health, but mental stress is a burden that, in my experience, mental stress causes more physical pain than any of these other three stressors. Mental stress is going to be your work, your finances, family, kids, relationship, social media, social pressures, comparison, right? And your phone. I mean, this mental stress is access to your phone 24/7, right? If you've ever been trying to fall asleep and your phone's on the charger and all of a sudden you get a text message, I guarantee you it makes it more and you hear your phone ring on that text message. I guarantee you it makes it harder for you to fall asleep. Most of us are going to roll over to see what that text was about, this, that, the other, right? But all of this is mental stress, and it's very hard to escape mental stress, and long-term mental stress leads into health issues, okay? The last category of stressors is going to be your chemical stress, okay? And chemical stress is oftentimes very well overlooked. We all know some of the big chemical stressors, your recreational drugs, your alcohol, nicotine, caffeine, right? But oftentimes we don't see some of our other chemical stressors. And other chemical stressors could be the medication that you're taking as a prescription, right? It could also be food dyes, preservatives, pesticides, microplastics, air pollution, household cleaners, uh, soap, deodorant, lotion, perfume, makeup, right? These all have toxic chemicals in them that, when exposed to our body and our nervous system over long periods of time, can lead into chemical stress. Okay. So these are the three main categories: physical, chemical, and mental. Okay. Now, I call these stressors because stress is actually a response that your body produces to stressors. Now, there is only one stress response, and your body will not decipher and cannot decipher between these categories of stress. The body will respond in the stress response, whether it's mental stressors, physical stressors, or chemical stressors. It's going to respond in the stress response, which is shown on this page right here. The nervous system is what controls and coordinates every function in our body. This is knowledge that you learned in 3rd grade, right? Your brain tells your heart to beat. Your brain tells your diaphragm to move to fill the lungs with oxygen. Your brain tells the gut to contract and move food through, absorbing nutrients and whatnot. And everything, all the way down to the cellular level, is controlled by nerves, okay? And these nerves send communication two-way to the brain and the body to the brain, helping to self-regulate. And this is a process known as homeostasis. Homeostasis is the inner environment within the body. And your nervous system has what's called your autonomic nervous system, which is the largest branch of the nervous system. You have 3 main types of nerves. You have autonomic nerves, you have sensory nerves, and you have motor nerves, okay? Motor nerves are what move skeletal muscle. So to move your finger uses the tract of motor nerves. To feel pain or temperature on your fingers uses sensory nerves. And then the autonomic nerves are actually the largest branch of your nervous system. And this is what controls and coordinates all your automatic processes. So to move my finger, I have to think about it, right? To feel something on my finger, I have to touch something, right? But automatic processes are things like hormone release, the thyroid, the heart, the lungs, the gut, the digestive, right? These are processes that will occur even subconsciously, because they're not controlled by mental power. They're controlled deeper. They're automatic processes. There's two branches to the autonomic nervous system. You have the sympathetic nervous system, which is responsible for your stress response. This is your fight or flight response. Think of this as the gas pedal of the nervous system. And then you also have the parasympathetic nervous system, and this is your rest and digest response. Think of this as your brake pedal, okay? So, sympathetic nervous system, fight or flight. If a bear were to burst into this room right here, it would be your sympathetic nervous system that would kick in. That would cause you to either flee, fight the bear, or a third one, which isn't often talked about, is the freeze response. So, flight, fight, or freeze. Okay. Parasympathetic is your rest and digest response. This is that response that you get here next Thursday after you eat a bunch of turkey, right? And you're sitting down to watch the football game. This is that I'm tired, I'm sleepy, I'm digesting food, my heart rate decreases, my breathing increases, my blood pressure decreases, right? And when you think about these two responses, the sympathetic response and the parasympathetic response, which response is more inducive to health? Probably the parasympathetic response, right? The rest and digest. That's where our health, our recovery, our growth is going to occur. When we're stuck in that sympathetic fight or flight response, well, our body's not designed to live in this stress response. We're going to have high levels of cortisol, high levels of adrenaline, high levels of stress all throughout the body, which is going to lead to high levels of inflammation, high levels of issues. Whether those issues are aches and pains, digestive, gut, health, breathing, the body is not functioning well when it's stuck in that fight or flight response. Now, ideally, our body should be in a balance between the sympathetic and the parasympathetic, because we don't want to be too heavy in the parasympathetic system either. Being too heavy in the parasympathetic system is often associated with, sluggishness, depression, fatigue, right? It's the lack of drive, right? It's the just I'm down here. I just don't want to do that, right? That's the parasympathetic response. Whereas the sympathetic response is, I'm overwhelmed. I'm so stressed out. I can't do this, that, and the other, right? Our nervous system should be in a balance where we can respond in the sympathetic response when needed, and we can shift back to the parasympathetic response when needed, right? So let's talk about how stress actually affects our body. So when the brain is perceiving a stressor or perceives stress, it will send a signal to the body through the central nervous system, through the brainstem, into the spinal cord, which will activate what's called the sympathetic nervous system. It's a chain of sympathetic ganglia, which is a bundle of nerves all throughout the mid back. And this will send signals to all these different vital organ systems to make physiological changes, and physiological changes such as, an increase in heart rate, which is going to increase your blood pressure, a decrease in digestion, an increase in alertness, a decrease in fatigue, right? Think about all the things that would happen if you suddenly faced a life-threatening event. That is the physiological changes that the sympathetic nervous system will trigger, all right? Now, long-term stress leads to physiological changes within the mind and body, and this is known as sympathetic dominance, all right? This is living life in the sympathetic nervous system, living life in that fight or flight response. Now, living in a fight or flight response can present with and lead to a wide range of symptoms and concerns. This is not a like, okay, oh, you're living in the sympathetic response. this is your symptom. Okay, it changes and it differs, and it's widespread for everybody depending on their level of stress, their duration of exposure to it, and many other limiting factors, right? Which we call the limits of matter. Okay, so here's the effects of long-term sympathetic dominance right here. So an increased heart rate and blood pressure. Okay, I'll read this little second note here afterwards. Okay, increased muscle activity, increased breathing rate, increased inflammation, decreased blood flow to organs, increased blood sugar levels, increased mental activity, dilated pupils, decreased sleep, and decreased digestive function. Now, if those are the physiological changes of the sympathetic response, this chronic fight or flight response, look at the second points, right? How does that physiological response respond or result in health, right? Heart disease, the number one cause of death, right? And increased heart rate and blood pressure and all this, increased breathing rate, all this other stuff is going to lead to heart disease. It's going to lead to heart issues, right? So do you think we're living in a chronic stress environment? Most definitely, right? Increased muscle activity, muscle tension, right? That's pretty daggone common. Increased breathing rate, all right, where your breathing shallows and becomes rapid. Shortness of breath, sleep apnea, asthma, all of which are steeply on the rise. Okay, increased inflammation. This can result in autoimmune issues, arthritis, and chronic pain. I'll tell you, all of which steeply on the rise. Okay. Decreased blood flow to organs. This can lead to organ dysfunction. If the organ isn't getting the blood flow it needs, it's not going to function correctly. Okay. Organ dysfunction, migraines, and headaches, all very well commonly associated with poor blood flow to the brain. Increased blood sugar levels, diabetes, right? This would be your type 2, the type that you grow into, not the type you're born with, right? Increased mental activity, anxiety and depression, and that's on the rise too. At least it's getting a lot more recognition nowadays with mental health. Dilated pupils, long term of that's going to lead into vision issues, headaches, dizziness, cataracts, and the list goes on and on. Decreased sleep, leading into mental health problems, fatigue, and depression. Decreased digestive function leads into immune issues. Immune response is all regulated through the gut. The IgE antibodies released by the gut. This is what fights off, the bad stuff. Okay. Acid reflux, gut health. Gut health has a wide range of concerns. Your gut is so intrinsically circled by nerve supply that there's actually a ton of research coming out about what's called the gut brain. They think it's a second brain in the body, which is insane. Anyway, let's keep going here. So I have a question there at the bottom. Is life more stressful today than it was 10 years ago, 20 years ago? That's just a thought-provoking question. You can think about that yourself. Okay. So treating the symptom. Okay. This is more of, you remember we talked about the allopathic, the pathogenic model where we're thinking about the thing that makes you sick. We're thinking about the body as individual systems and whatnot. Here's some facts about our results with health when it comes to treating the symptom. Okay. According to the National Institute of Health and the CDC, 50 million US adults live with chronic pain. Okay. 60 to 70 million people are affected by digestive diseases. One person every 33 seconds dies from cardiovascular disease. Around 72% of physician office visits include some form of drug therapy, right? So when presented with a symptom or a concern, to address that symptom or concern, 72% of these visits are dealing with some type of medication for that symptom or concern. Here, this is a staggering statistic here from the National Institute of Health that men are expected to spend 43 to 51% of their lives on prescription medication, and women are no better, 52 to 63% of their lives on some form of prescription medication. That's crazy, right? More than 100,000 people die annually from drug overdoses. Most of this is involving opioids, which thankfully there's been a lot of processes to really help manage this opioid pandemic that we're experiencing. But still, there's a lot of that going on, fentanyl, a lot of that. Okay. Anyway, here's a couple of statistics for you. So, where does America rank in healthcare spending? I'll let you guys just kind of think about that for a second. Then we're going to hit this top button right here to see where we rank in healthcare spending. So here we are, the United States. We are number one, okay, with the next closest spending about $8,000 annually on an individual. We're spending close to $13,000. So that's a big jump, right? So we're number one in healthcare spending. So with that number one ranking of healthcare spending, where do we rank in healthcare quality? Let's take a look at that. So these are developed nations here. Singapore ranking number one, Japan number two. You can look down this list here. There's 13 listed here. So you can see 1 through 13, and America, United States is not up there. So let's go to the next page here. So this goes 14 to 26. America, not quite up there yet. 27 down to 39. There's United Kingdom, no United States. Let's go to the next one. So here we are going all the way down to 52. Still no United States. Let's keep going here. Croatia, Saudi Arabia, Iran. Still no United States. We're down to 65. And here we are, United States, ranking 69th among developed nations in healthcare quality. And just to kind of see what this is actually looking at here, the health pillar, you can see right here, evaluates the degree to which people are healthy and have access to the services required to sustain good health, including health outcomes, health systems, and risk factors, and mortality rates. So 69th, that's pretty low, right? So this is an interesting research article here. What is the third leading cause of death in the United States? This one is a National Institute of Health research article here. You can read the whole thing if you want, but just this top sentence shows us medical errors have been more recently been recognized as a serious public health problem, reported as the third leading cause of death in the U.S. And this is a study from Johns Hopkins University here, showing that report about 400,000 hospitalized patients experience some preventable harm each year. That's staggering, right? Now, the reason that you won't see this medical error stuff listed on, you Google the top mortality rates or the top reasons for death, is that medical errors is such a hard thing to track, right? Like, obviously, we know if someone goes into the hospital and they, are allergic to this and this accidentally gets put in their medication, they have a reaction and die. That's a pretty evident medical error, but there's so many variations of medical error that it's very hard to track that. And this researcher here at Johns Hopkins University tracked several different factors. You guys can read that if you're interested in that, but that's pretty shocking, right? And then where does the U.S. rank for life expectancy? If we hit this last one, we'll take a look here. This is from the CIA. So we're just going to kind of go down the list here, looking for the United States. Still nothing coming down. Getting into the 30s here still. There's the United Kingdom. I always see that one, think it's the United States, but it's not. Here we go. We keep going, keep going. There we are. United States ranks 49th among developed countries for life expectancy, which is about 80.9, which is actually, higher than it used to be. But anyway, this shows us here that treating the symptoms is not producing healthier outcomes, right? The pathogenic and emergency care have their place in healthcare, but it shouldn't be our first option, right? We should look at the body as a whole, see if we can improve the function of the body as a whole, better the body to reduce the symptom instead of treating the symptom to try and better the body, okay? We spend more time and effort on improving the function of the body as a whole, we're going to be healthier, okay? And this is simply put, just, exercise, eating healthier, drinking more water, taking care of yourself, and reducing your stress response, right? If we take care of ourselves as a whole, it's better than treating the symptom, okay? Because I can tell you that the symptom is not often the problem, okay? So first and foremost, here at the bottom, it says we must assess the function of the nervous system. Improper communication within this system will lead to dysfunction of the body. Dysfunction of the body produces symptoms, right? So here's some thought-provoking questions. I want you guys to just think about these. You don't need to answer them or anything like that, but is the symptom the problem? Are symptoms signs of long-term dysfunction? Can the body heal itself, and how? Does the body function as a whole or as individual parts? Is the body all connected, and how? And can the body change and adapt, right? Just think about those questions, right? So what is chiropractic care? So chiropractic is a philosophy, science, and art of assessing and correcting vertebral subluxations by adjusting the spine. Chiropractic works with the body's innate ability to self-regulate and heal itself. This is known as innate intelligence. So innate translates to inborn, and intelligence means the body's pretty smart, right? When the sperm and egg met and split and divided and split and divided and split and divided, the very first thing that developed was the nervous system, was the brain and the spinal cord. And from the brain and spinal cord, the rest of the body developed around it. The nervous system, the central nervous system, is so important that it's the only organ system in the body completely encased and protected by bone, which is the structure of the spine. Our body has an ability to adapt, respond, change, grow, thrive in incredible ways when given the right environment to do so. This pretty much boils down chiropractic care in a bundle right here at the bottom. Reducing neural stress improves neural function, improves organ function, improves body function, reduces symptoms, and improves health outcomes. So vertebral anatomy. Let me just play this video here because these guys do a really good job. Spine health here.
Believe it or not, baby.
At University of Phoenix,
You
could earn your master's.
For under 11,000.
11.
Yes, 11! Master's degree for under 11K in less than a year.
Some things are too obvious to be a coincidence. Earn your competency-based master's at University of Phoenix.
The spine is an interconnected complex of bones, nerves, muscles, tendons, and ligaments, any of which can become damaged and cause pain, neurological symptoms, or loss of mobility. The vertebrae are the bony building blocks of the spine. There are 7 cervical vertebrae in the neck, 12 thoracic vertebrae in the upper back, and 5 lumbar vertebrae in the lower back. Each vertebral segment is comprised of a cylinder-shaped bone in the front of the spine called the vertebral body, a soft cartilage disc between each vertebra, and paired facet joints in the back. Each segment is named for its upper and lower vertebra, such as the C6, C7 segment. The bones in the spinal column surround and protect the spinal cord, which runs behind the vertebral bodies in a canal from the neck down to the top of the lumbar spine. In the lumbar spine, the nerves branch out from the spinal canal and exit the spine in a pattern that resembles a horse's tail, called the cauda equina. At each segment, spinal nerve roots exit the spine through holes in the back of the vertebrae, called foramen. Any compression of the nerve root in the foraminal opening, which can occur due to bone spurs, herniated or degenerated discs, or facet joint problems, can cause pain and possible neurological symptoms to radiate along the path of the nerve. These symptoms are commonly called radiculopathy, and leg symptoms may also be called sciatica. In between the vertebrae, the intervertebral.
Now, not only can that cause aches and pains, but what if that nerve goes to the stomach, right? If that's affecting the communication of that nerve, is the stomach going to function at its best, right? If the nerve is only sending 75% of its signal to the stomach, is the stomach going to function at 100% or is it going to function at 75%, right? So this video is great because it shows you all that, but it's really only talking about pain again. We need to think about the autonomic function. We need to think about the body as a whole, not just the
Vertebral
pain.
discs serve as shock absorbers and help
So
facilitate
let's jump back to the slideshow here. So there's 32 pairs of spinal nerves that branch off the spinal cord. They just run in between the spinal bones like you just saw in that video, all right? The autonomic nervous system, we've already kind of talked about it. It's got the sympathetic, the parasympathetic, rest, digest, fight or flight. You can see what it increases here in the stress response and what it increases and decreases here in the rest and digest response. So when we have that inflammation on a spinal nerve, it's going to shift us into the fight or flight response, right? And lead into those health concerns that we already talked about. So a vertebral subluxation, this is what chiropractors are looking to treat. We're looking to assess and correct vertebral subluxations. A vertebral subluxation is a misalignment in the spine that causes neural stress and interference to the communication through those spinal nerves. So in that video, when that bone misaligned and you saw it kind of radiating down the sciatic nerve, that's affecting the sensory nerve. But remember, we have motor nerves and autonomic nerves. Now, what if that compression affects the autonomic nerve? This leads into an issue called dysautonomia or somatic dysfunction, all right? The communication is two-way between the brain and the body. So dysfunction in the spinal nerve leads to dysfunction in the body, okay? Without 100% nerve supply, the organ can't function at 100%, body can't function at 100%. Ultimately, we lead into symptoms and health concerns, all right? Now, here is a chart. I know these words are really small, kind of blurry. We give this chart out at your new patient visit, but basically this is an amazing chart showing you the spinal nerves here, C1 down to the sacrum and coccyx right here, the areas of the body that those nerves go, and the possible symptoms, issues, conditions, concerns you could have with that inflammation, dysfunction, and irritation in that spinal nerve, okay? So instead of treating the symptom over here, we're looking to correct the communication over here with the vertebral spinal nerves. So what is an adjustment? So an adjustment is a specific and gentle force to the spine that does two things. It's going to realign a misaligned vertebral bone. Now, when a bone is misaligned out of its proper position, it's going to cause a lot of tension in the muscles and ligaments. So putting it back in its proper position is actually going to relax these muscles and ligaments. It's going to improve posture. It's going to improve the range of motion, and ultimately it's going to decrease pain. But it also does a second thing. It also stimulates the nervous system. It excites a spinal nerve. It sends a signal through that spinal nerve up to the brain, which then excites a bunch of neurotransmitters up in the brain, which produce an output right back down the spinal cord and out through that spinal nerve, now stimulating the visceral organ systems or the muscles and ligaments, the cellular systems that these nerves supply, which create an internal, a physiological change within the nervous system. So it excites the nervous system. The impulse travels up the spinal cord to the brain. Brain produces a signal, sends that output right down, improving the function of that spinal nerve, okay? And actually, you can see a couple pictures here. This is our model of adjusting. We don't do the twisting, cracking, popping thing. We use a handheld instrument right here to adjust. It's extremely gentle. It's more of a stimulus to the nerve. Dr. Packenham talked about pediatric chiropractic care. We see a ton of kids. This is actually my youngest right here. His name is Levi. He's getting an adjustment to the pelvis. So nerve assessment. Chiropractic actually has a lot of technology that we can use to assess how the body's functioning. All three of these scans were from the same patient. As a matter of fact, all these muscle scans are from the exact same patient of these nerve scans as well, okay? So this scan on their far left shows high levels of inflammation and stress, C2 down to C5. You can see the green and blue bars in the mid to low back as well. 5.1 is the scale here in the top of the neck region. This was this girl's initial exam, all right? Came in with migraines, thyroid problems, digestive, gut health issues as well. This was her first re-exam right here. So you can see that middle scan right here. Notice the huge decrease in stress in these spinal nerves, right? All of a sudden, our largest scale here is a 4.2 in the upper neck. Notice all the big changes through the low back, mid back, and how this scan looks a whole lot cleaner. This scan right here was 1 month after she started care. And then this is her final re-exam right here. Notice no more red bars. Red bars showing us severe levels of inflammation, stress, none of that left over. And the symptoms, the improvements to her symptoms are severe. I mean, like no longer taking her thyroid medication, no longer needed. Her thyroid's working just the way it's designed to. Gut health, obviously she's out of pain, right? These migraines have gone away. It's incredible, okay? And it's all just a show of like, if we improve the function, these symptoms go away. Now let's look at this same girl's muscle exam. So what you're looking at with the muscle exam here are these black lines. So the black line on the left right here shows us the muscles on the left side of the spine. The black line on the right shows us the muscles on the right side of the spine. Left and right should be nice and symmetrical. We should have good balance. We also want to see these black lines be inside that gray shaded area. That's the normal threshold for muscle activity. If the black line is outside the gray, it shows us higher levels of tension and stress in the muscles. This was her initial assessment. You can see very dominant on the muscle activity on the right, very lacking of muscle activity on the left, okay? This was her first re-exam. Now we're seeing a lot of muscle activity, which is something we want to address, but at least we've got the symmetry, right? We went from a symmetry score here of 20% to a symmetry score here at our first re-exam of 88%, okay? Now let's look at her final muscle re-eval. So over here, we got the final muscle re-eval. We can see most of the black line is in that gray shaded area. We can see the symmetry. All of that is phenomenal, okay? This is the same girl with these nerve scans. Now let's look at these x-rays, okay? This is someone's initial x-ray coming in. Our neck is curving in the wrong direction, 23 degrees with a forward press, a forward curve. Normal curvature curves in the other direction, 40 to 60 degrees. Here's her post x-ray here on the right. We can see a dramatic improvement here. I know I'm running out of time here, so I'm going to speed up a little bit. This is our lumbar x-ray, our low back. We can see this girl right here. 2 degrees off on that left side significantly higher than the right pelvis. Here's her post x-rays here on the right. You can see she's perfectly balanced, which is what we want, okay? This is just showing you structural improvements, okay? So that concludes my my presentation there. Let me stop sharing here. Oh, you guys can write this down here at the bottom, info@AdaptRaleigh. That's our email there. If you guys have any questions, or if you know you want some help with something, just shoot me an email. I'd love to hear from you. But I'm going to go ahead and stop sharing my screen here, and I guess pass it back to Dr. Packenham. I think you guys got maybe some questions and answers and stuff.
So I told you all you were in for a treat. And we got a great lesson tonight from Dr. Simonsen. And I wanted to also say, I didn't get to say, I was rushing when I came on because as my people know, my computer crashed right before we started. So I had to hurry up and restart my computer to try to get on this Zoom. But you are no stranger to women's health awareness, and you were with us last year. And quite a few of our women health awareness participants started coming to you for help with their inflammation or their chronic issues. And that's how you ended up here tonight, is because I kept getting emails and phone calls about you and how much their health improved after coming to you for several sessions. And these were women driving from Durham to Raleigh to your clinic to be able to have that. So I want to thank you for such an educational and informational a presentation tonight. And one of the things I learned, I'm going to take this tagline: the silent assassin to good health is stress. And in many ways, through mental stress, through the environmental exposures, as well as to physical, which could be traumas we experience in our life. And with the sympathetic and parasympathetic nervous system, I'm going to be thinking about you next week after I eat that turkey. And I'm sitting on my couch with my food digested. I'm going to talk about the parasympathetic. My parasympathetic nervous system is doing its job. So thank you so much. Jaslyn, do we have any questions? Let me look at the Q&A real quick.
Yeah, we actually do have a couple of questions. We do have one question, Dr. Simonsen. Can you address stenosis?
Absolutely. So the definition of stenosis is narrowing of the foraminal, the spinal foramina, and that's where the nerve exits the spine going out to the body, right? So a lot of people get stenosis from degenerative disc disease, which is a form of arthritis, or trauma to the spine, but most of it is actually just due to a misalignment in the spine, right? When it comes to disc degeneration, the definition of disc degeneration is that the disc is degenerating. So there's a disc in between the spinal bones, and that acts as the shock absorber, if you remember that video I showed you there. Now, if the spinal bones are misaligned, it's not going to put even weight on the discs. Now, over time, that disc will wear thinner and thinner and thinner because the stress that it's under from the load of the spinal structure. So if we can adjust the spinal bones back into their proper position, it's going to open that spinal foramina and really remove a lot of the stress and inflammation on the spinal nerve. Now, a lot of spinal stenosis is going to give you a lot of ache and pain, the radiating, the numbness and tingling down the arms and legs and stuff like that. But if you're feeling the ache and pain, it means that that problem has been there for a very long time before the pain came about, and it could be leading to some functional issues as well. So yeah, we see a lot of that.
Okay, thank you for your answer. And we do have another one that came through the Q&A. What kind of test measures the red, blue, white, and white areas along the spine?
Yeah, that's a great question. That's using infrared thermography. So we know that inflammation releases heat. So we're comparing the heat release on the left and the right sides of the spine, and they should be nice and even and balanced. When there's big levels of inflammation or stress, it's going to cause a deviation in the heat towards one side, which is where you see those bars. Yep, that's a great question. This is actually designed. This test was actually designed by NASA, and it was used to see how the nervous system would respond in astronauts who go zero gravity. And then, some private medical people took that assessment and moved it to the medical field.
Okay, thank you. And then I got a follow-up question was asking how long was her total treatment?
Yeah. Yeah. So I showed you a couple different people. The lady with the nerve and muscle scans, her plan was 9 months long. The majority of that 9 months, however, she only came in twice a month. Okay. So in our plan, we have 3 different phases of care. We have active care, stability care, and maintenance care. And most plans, you're only coming once a week down to twice a month once we get into the maintenance care. But that active care is about repetition, and that's where we see a lot of people pretty frequently in the beginning.
Okay, so it sounds like consistency is key when going through
Consistency
chiropractic
is
care.
key with any change you want, right? Sticking to a
Yes.
diet, sticking to an exercise program. The repetition and time are the #1 things when it comes to health and change.
Okay. Next question says, how do you know when adjustments are no longer needed? Many chiropractors want to put me on a plan that goes on for months. I can't tell if this is just a way to get money from the insurance company or, is it their way of actually helping?
Man, that's a great question. And honestly, if you're asking that question, it means that your chiropractor hasn't done a good job of explaining the need and for maintenance care. It's simply put like, let's say we're on a diet and our goal is to lose 25 pounds. We're eating salads, we're exercising, and we lose 25 pounds. And we're asking our personal trainer, hey, how long do I need to eat healthy and exercise for? Do I have to do this for the rest of my life? You don't have to, but if you want to be healthy, you want to maintain that health, and you want to maintain those structural changes that we see on that x-ray, yeah, some level of consistency, some level of continued care is optimal. I mean, people spend 2 years in braces and then spend the rest of their life in retainers and don't think about it, to keep their teeth straight, right? So, um, maintenance care in the chiropractic field is pretty critical. Yep.
All right. And now we're going to shift a little bit, Simonson. So this one person says, do you ever see women who experience chronic pelvic pain or, pain that occurs like during female exams or even intercourse as well, too? So kind of shifting the
Absolutely.
focus more towards women's care.
Absolutely. And we often see this, it I'm not diagnosing you over the phone or anything like that, but I would look into pubic dysfunction. It's known as SPD, symphysis pubis dysfunction, and that's where your hips will join in the front and they're stabilized and secured by a dense ligament known as the pubic symphysis. And a lot of times when your pelvis is misaligned, you're going to have a higher side, which is going to stress and strain the pubic symphysis. And the pubic symphysis, if you want to like touch it and palpate it, is about 2 to 3 inches below your belly button. And a lot of times it can get very, very tender during pregnancy when the hips are expanding and whatnot. But I've seen it happen in men. Doesn't have to be just females. But yeah, that's pretty common when it comes to intercourse pain and period stuff and all that. So that's pretty common.
Okay, and then there was another question that somebody has submitted. They wanted to know, and I feel like you kind of hit on that, but it was kind of broad how they placed it, wanting to know chiropractic options for like endometriosis, PCOS, or fibroids, like has anything to kind of correlate with chiropractic care?
Oh, absolutely. Absolutely. I mean, the whole idea is to think that chiropractic isn't treating a symptom, right? So whether it's endometriosis, as fibroids, or anything like that, like if we can improve the function of the body, then we may be able to reduce those symptoms, right? So, I can't promise that we can treat or cure this type of stuff, but if we can improve the body's function and that brain body communication, we see a lot of that stuff get better.
Awesome. We did have somebody else in the Q&A that asked, how often should you have chiropractic adjustments?
It depends. You know what I mean? It depends. Most of our people who opt into like a wellness care after their active care, we see them twice a month or once a month. Though we see some people less than that. You have to think, how stressful is your life and what is your day-to-day like, and what are your goals? But some is better than none. Hitting the gym once a year is better than not going at all, right? So that's up to you.
Absolutely. Are there any specific chiropractic techniques or adjustments designed to address tension caused by chronic stress?
All of them. Yep, all of them. Now there's different models of chiropractic care. You've got your structural model and your neurologically based model. I would almost always deviate towards the neurologically based model. But we would have to do a whole nother webinar on the different models of chiropractic care.
Of course, there's so many techniques. Additionally, so during your presentation, you mentioned you use an apparatus instead of the like adjustments. Is this the standard of care now?
There's more and more chiropractors are moving towards more gentle approaches. And the reason being is that research is showing that we actually need to do less, right? We need to do less to make more impact. A lot of times with these big old school rack 'em, crack 'em type adjustments, that it's actually producing a little bit more stress in the body, leading to more trauma, oftentimes more stress response, right? So being more specific with our stimulus or specific with our adjustments makes better outcomes.
Okay. And then we actually have someone who is a physical therapist who was on tonight, and she stated
Great.
she see how our professions intersect in many ways. I'm seeing more chiropractors and PTs working in partnership. Do you work with PTs? And if so, what does this partnership look like for you?
I absolutely love working with PTs. I love working with medical doctors. You know, my goal is to improve people's quality of life and improve their quality of care. I only do adjustments in the office. So if there's stretching and, you know, let's say ultrasound or e-stim or any of these other therapies, I let the PTs, the masters of that, do that. And if the, PT, please send me an email. I would absolutely love to connect with you.
Well, Dr. Simonsen, it seems like one of the questions that came up a couple of times had to do with the number of visits that you have to have that you do. So through your chiropractic care, do you also give people ways to maintain at home or ways to exercise at home so that they don't have to come back as often, or their body, I don't know what the term is, but their body doesn't need it as often because they're actually exercising, doing specific exercises for their specific area of interest?
Absolutely, absolutely. We give them a whole home care packet of stretches and exercises. And a lot of this also just deals with, you know, okay, what is your day-to-day like, right? Do we need to adjust your seat? Do we need to buy a standing table, right? Are you work from home? What is your environment like that? With that, what's your environment like that? We have to think about, where do you spend the majority of your time, right? What's your sleep posture like? The majority of us sleep super funny for 6 to 8 hours at a time and then wonder why we wake up with a kink in the neck, you know? So absolutely, ergonomic tips, stretches, and exercises. And our plan is actually, you know, our care plans are based around working you out of the office, right? To where you have more stability, that you make better changes yourself, that you take on more responsibility of your health, right? And don't become reliant on me as a chiropractor or them as a physical therapist or them as a nutritionist, that they become more knowledged in the ways of how their body functions so that they can go and make those choices to be healthier in the future.
Excellent. Also, many of us are, I heard you say, many of us are working at home. We are working at our home and at our desk. And you said 4 hours, and I'm gonna go 8 to 12 hours
Right.
a day. I'm just sitting in front of the computer, like, tonight's an extended night. So you've been working since 8:30 this morning, and you're still here at this time of night. And so, once you come in, because all of us there, my friends, we're talking about our posture. Is it the age thing, or is it really because we're sitting at our desk all day, hunched over, typing, looking at the screens, the monitors, and, are there exercises? I know we probably need to come and get an adjustment, but once we get that adjustment and get our necks aligned perfectly, we need to be able to have exercises or something that we can do at our desk or something like that to make sure that we stay in alignment,
I got some great tips for you. Okay. Number one is that you know, when we're at our desk and we're sitting on at home or whatnot, our neck and our upper back and our pelvis is in a C, right? A C shaped. We're curved forward. So one easy thing that you can do to prevent or to, you know, go back from that is to put your body into extension. So how would you do extension while also working on your computer? Belly time, right? You put your laptop on the floor and you lay on your stomach and you prop yourself up by your elbows here. And now all of a sudden you're pushing your chest up and you're looking up with your neck, and now you're in extension, right?
Okay.
Now, obviously don't do that if you have elbow or shoulder issues, but you can still do it for a couple minutes. And I'm telling you, it's going to make a huge impact. The other thing you can do is put your water bottle on the other side of the house. And every time you want a sip of water, it makes you get up and walk, just like you're at the office where you have to go to the water container, right? You can set timers on your phone as like every 15 minutes, I'm going to stand up and I'm going to respond to this email standing up, right? A lot of us have these Apple watches and stuff that tell you, oh, time to stand up and whatnot. Just trying to get some more, movement into your day is just a critical part, but definitely do that belly time trick. I'm telling you, it's gonna
So you
change your life.
said get down on the floor, stretch out,
Yeah,
put our elbows down, and then stretch back.
that's right. That's right. It's
Okay.
actually it's a yoga pose called the Sphinx pose, but you can actually work on your laptop. You know, I wouldn't do it on a webinar or a Zoom call, but you can definitely respond to an email like that, you know,
Yes.
and it's a good tip.
Wonderful. Well, thank you so much for this outstanding presentation. I certainly have a better understanding of chiropractic care and how it can work together with traditional medicine to, to help improve our health. And so we greatly appreciate you tonight and look forward to seeing you at Women's Health Awareness 2025
Yes,
in
ma'am.
April.
Yes, ma'am. I'm
So
excited.
thank you
I'm
so much.
excited.
Don't go anywhere. We have a couple of things that just housekeeping things that we have to do. Let me see if I can show my screen again. Share my screen. So we also have some chiropractic care resources for you that's on the on our website, which is located down at the bottom of the screen. So please go and look at our chiropractic care resources. Also, immediately following this webinar, evaluations will be sent to you through email. And note that, of course, as always, for attending the Women's Health Awareness webinar and completing the evaluation, you will receive educational contact credit hours for your participation. And for those of you who completed the evaluation and signed up to be part of the raffle, the winner will be announced during our November webinar. Please save the date for our 11th annual Women's Health Awareness Conference. Free registration opens on January the 2nd, 2025. Our event date this next year is Saturday, April the 12th, 2025 from 8 a.m. to 5 p.m. And our location will be at Hillside High School. For more information, make sure you go to the Women's Health Awareness website. But please put this on your calendar and remember to start registering on January 2nd, 2025. This will be our last webinar until the new year. So at this time, we want to thank you for your support and your time and attention. We know that this is late in the evening, and so we thank you for your participation, but have a happy Thanksgiving and a happy and joyous holiday season. Thank you so much for joining us tonight. We greatly appreciate you, and thank you for your support and attendance. Have a great evening, everyone.